Hi. Together, we are going to study and prepare to sit for the Healthcare Information Security and Privacy Practitioner exam, or for short, HCISPP. Each week, we'll go over the information included in each of the 6 domains included or covered on the exam. So let's begin with Domain 1, which covers the healthcare industry. First, we want to make sure that we are clear on what the different types of healthcare organizations are. Of course, you're familiar with the providers. These are the organizations and professionals that provide hands-on care to our patients. So includes physicians, hospitals, nursing homes, long and short-term care facilities, and others. But this category also includes pharmaceutical companies, third party payers, and business associates because they all participate and are necessary for the proper delivery of care. Health information technology, and I'm sure you've heard this term many times. And this is the umbrella term that's going to include hardware, which has the scope from anything from a laptop and a desktop computer to include medical devices, even those that patients use at home that may transmit data back to the provider. In addition, we have to remember where there's hardware, there must be software. EHR, electronic health records, personal health records, these are software programs that are used on hardware. They go hand in hand like signs and symptoms. And of course, we must have the function of interoperability for computers to share data with each other, both within the same facility, from a facility to health information exchange, HIE, through networks to other providers in the area, and also don't forget state and federal governments and agencies who not only oversee the function of healthcare providers and what they do, but they also participate in the process, for example, funding and research. Now, health insurance, oh, it's always on people's minds. And what you want to make sure you're familiar with in preparation to sit for this exam is certainly going to be the payment models. And by that, you want to make sure you fully understand fee for service, capitation, as well as salary. Fee for service is, just as the name says, the providers are paid for each and every individual service, treatment, or procedure provided to the patient as reported. Capitation is one regular payment every month, whether the provider sees the patient or not. And salary, you may be familiar with the term hospitalist. Hospitalists are a new category of physicians who do not have separate individual offices to see patients. They actually are working for the hospital, and that's the only place they see patients. And then, of course, you should be familiar with claims processing. Now, how does anyone know what is going on? Well, the way this is done is we have professionally trained medical coders who understand the language of medical terminology and interpret what the physician has documented into the proper codes or code set. So let's take a look and just review this alphabet soup of code sets. Okay, SNOMED CT is the clinical terminology that is agreed upon for exchange throughout the world. So, this is a comprehensive, multilingual clinical healthcare terminology that provides the core general terminology to be used by electronic health records, and it formalizes logic-based definitions. So essentially, everybody got together. Actually, they had a worldwide committee from physicians from different companies that got together. I mean, countries that got together and agreed, okay, this is the term we're going to use for this condition. ICD 9, ICD 10CM. This is the code set used to explain why the patient needed healthcare services and the attention of a physician. In the United States, we used to use ICD 9CM. On October 1st, 2015, this was replaced by ICD 10CM. Normally, I wouldn't mention ICD 9. However, the information I have is that this exam may have been written prior to the transition. So I don't want you to get thrown by a question on the exam that might say ICD 9. You want to focus on diagnosis codes to explain medical necessity, why the patient required care. CPT stands for clinical procedure terminology. This is a procedural code set. In other words, we use it to explain what the physician did for the patient. This code set is created and maintained by the American Medical Association, and it is used to report physician services in any type of location, as well as outpatient services provided by a facility. HCPCS Level 2 codes is from the United States federal government, and this is kind of a supplemental code set that's used to report anything that is not already represented in CPT. For the most part, this includes ambulance services, durable medical equipment provided to a patient for use at home, not in a healthcare facility, like a wheelchair or a hospital bed, as well as medications that are administered to the patient by a healthcare professional. CDT, current dental terminology. This is the code set used to report services provided by dentists. Okay, technically, it is a subset of HCPCS Level 2, but it is also maintained and published separately by the American Dental Association. The DSM, Diagnostic and Statistical Manual of Mental Disorders. Okay, I know DSM, Diagnostic and Statistical Manual. They don't include the mental disorders part in the initials, okay? But the DSM is used by psychiatrists to fully explain mental and behavioral disorders. The NDC is the National Drug Code administered by the Food and Drug Administration in the United States and identifies drug products. And last but certainly not least is ICF, the International Classification of Functioning Disability and Health relating to reporting disabilities. Okay, once the procedures are provided to the patient, and for good reason, medical necessity from the diagnosis codes, we then begin the process of billing, payment, and reimbursement. Okay, so we take the physician documentation and the medical coders interpret that into the appropriate codes, which are then placed on the claim form. And then the claim form is submitted, and that the claim form being created and submitted is the billing process. It really is separate from coding. And that will lead to reimbursement and payments. Why do we have two words? Reimbursement comes from a third party payer, a payment comes from a patient. So, from the third party payer, you may be familiar, should be familiar with EOBs, explanation of benefits. These are documents that go from the third party payer to the beneficiary, to the patient. And essentially it says, hi, we're your insurance company. We just want you to know we paid this amount for these things to Dr. whomever or whatever hospital. Okay. Then we have the ERA, which is the electronic remittance advice. This is the document that goes from the third party payer to the professional, the facility, the provider. And this is like the packing slip that goes along with a bulk payment. Almost always, this will be for several patients and it will be itemized. We gave you $6,000 for what you provided to Helen. We gave you $10,000 for what you provided to George. And we gave you $72 for what you provided to Annabelle. Okay? So, EOB goes to the patient or the beneficiary. ERA goes to the provider to explain the money that has now been put in the bank account. Now, from the patient's side, you're probably familiar with this from your own life. The patient will pay often a copayment, which is a set standard fee that patient always has to pay when going to the doctor. It makes no difference what was done. It makes no difference how much it cost. This patient is always going to pay that $10, $25, $50, whatever it might be. The deductible is a total annual amount that the patient must pay out of pocket before any benefits or coverages go into effect. And then coinsurance is a percentage of, also known as cost sharing, where the patient pays a percentage and the third party payer will pay a percentage. You may have seen this somewhere. Often it's referred to as an 80-20 or a 70-30 type of payment. So just to make sure you're clear, a co-payment is a fixed amount, always the same. Coinsurance is based on a percentage of the entire cost for that episode of care. The next thing on the list for what you need to study for Domain 1, this part of the exam, is workflow management. And in this particular case, we are looking at the details that come from HIPAA's administrative simplification provision that lead to items that we must pay attention to regarding the security and privacy of health data. This is directly with regard to how the data is moving, when the data is moving, where the data is moving to, and to whom the data is moving. We must keep control of all of these things. We also need to constantly evaluate our processes to be working constantly on improving the efficiency and the effectiveness of our responsibilities with regard to patient data. And that includes storing the data, making it accessible when it's needed, managing the data to ensure that it is protected, and sharing the data when that is required. Due to law, regulations, or patient request. We also have here covered the minimum necessary rule, and this is very important. What this means is, in cases where you might not have blanket privilege or permission from the patient to release information, we do have to remember that things can happen very quickly in healthcare. And so therefore, there is an allowance in HIPAA's privacy rule that says, in your best judgment, doctor, you may determine to release certain details about this patient without permission from that patient. However, you only may release that which is necessary. You do not go into the patient's whole life story or any personal details that are not relevant. Only the minimum necessary so the individual receiving the information can do their job properly and no more. The next concept in this workflow management aspect of our responsibilities is called separation of duties. And for the most part, this has to do with conflict of interest and restricting the potential for fraud by making sure not one single person is responsible for all aspects of a financial transaction. So, as an example, you want to make sure that the person in the facility who is collecting money from the patient for that co-payment or that deductible or co-insurance is not the same person who enters these payments into the computer to the patient's record and is not the same person who takes the money to the bank. This way, we have several levels. Each person is responsible. And the theory is that if one person is looking to take a little step over the line, it's more difficult to get three people to cooperate with performing fraud and potentially going to jail than it is for one person to have ultimate power and control, because that can get people in trouble. The electronic data interchange, also known as EDI. This is the common language, and it's not language like English, it's language like computer language, so that computers can specifically transmit sensitive information such as for financial transactions, as well as claim forms and other information that is often related to some type of ultimately some financial transaction. So remember that when a healthcare facility submits a claim form to a third-party payer, yes, that's a claim form with patient information. It's a claim form with codes that explain what was done for the patient and why. This is not only protected health information, it's financial information, because that claim is being submitted with the intent to obtain reimbursement. So it affects money. Okay, the regulatory environment and healthcare, of course, has a lot of people looking over its shoulder, as well it should, because we are an industry where literal life and death is at stake. So, of course, you should be familiar with HIPAA's privacy rule, HIPAA's security rule. HIPAA was passed by Congress in 1996, but it wasn't implemented until 2004. Important for you to kind of remember that difference, okay? And then, of course, be familiar with the Healthcare Fraud and Abuse Control Program, HCFAC, because very important aspects of controlling fraud and abuse with regard to healthcare. Millions, billions of dollars at stake. Also, the HCFAC is where the whistleblower statute is, that can lead to key TAM lawsuits, QUITAM lawsuits. Okay, public health reporting. Sometimes individuals get a little confused about this because we're not supposed to release any patient information without permission from the patient. However, there are certain aspects to our governance over this important information, and that includes the HIPAA breach notification rule, as well as the mandatory report requirements from almost every single state. So become familiar with that aspect as well. Clinical research study stages are something that you should become familiar with because it provides for the future of healthcare. Just as the wonderful innovations that we have now are the product of research studies that have come before us. It's amazing the difference in what we are able to accomplish for patients. And as you know, it's never enough because there is a constant challenge in healthcare for us to find better ways to prevent disease and injury, to diagnose more efficiently, and of course, to treat better. Healthcare records management is going to cover what I think is pretty much the standard when it comes to the health information management and health informatics. Is we have to remember that whether it's a single record in a file, on a computer, on a server, our responsibility toward that information is no different from when that information was written or typed on a piece of paper and put in a manila tab folder and put into a filing cabinet. So we are responsible for filing and storage of these records as well as protecting them. And that includes scanning paper documents, compliance, which is very big, as well as retention schedules. And this is very important that we have a very strict responsibility with regard to the management of documentation destruction, and as well as the management of non-clinical data, patient's name, address, credit card number, okay, things like that. So this is important. We don't destroy records like we used to now that we've gotten rid of or are getting rid of paper, but still the regulations are there. There are still providers using paper, so it's important that you become familiar with these details. Vendors. These are people, businesses who are outside the covenants of the organization. They are outsiders who have a business relationship with our healthcare facility. And they provide varied and sundry services, anything from the hosting service, your ISP to get on the internet, encryption services, both at rest as well as in transit, audit providers to do internal audits, and of course, security solutions. This may include the backups, such as using the cloud or a server in another state, as well as incident response. Various organizations use outside vendors in various different ways. Sometimes the vendor is a business in the same town or city or state. Sometimes it's a vendor in another country. Regardless, we are responsible for bringing them into the fold and onto the team with regard to the care and security of patient health information. So, the biggest thing about business partners that I want you to understand is the difference between a business partner and a business associate. A business partner is another outside business that has a relationship with this organization and they provide the same things, okay? So you'd say, why would I get involved with another company that does the same thing? Well, most often it's to have another location in a different part of town. So you may work for a hospital which has a business partner relationship with a clinic on the opposite side of town. So for when there are things that are not major, your patients can go there closer to home and be cared for. Okay? If the services are dissimilar to what your organization provides, that is a business associate. So this would be an external IT support, technical support organization, or your ISP, or it might be an outside coding and billing company. Data sharing. This is what we do now. Now that we have the benefit of electronic health records, we can more efficiently and effectively share data. We not only share data using the electronic data interchange, but then there's something called the WEDI, the work group EDI, electronic data interchange. So we must always be alert to aspects of interoperability, standardization, and security, because ultimately it comes down to us. Be aware of all of the initials in our lives, regulators that will tell us what to do and how to do it. The Department of Health and Human Services, the Office of Civil Rights, which is the sub-agency within the DHHS that oversees HIPAA compliance, the National Institute of Standards and Technology, the Federal Information Processing Standards, the Federal Trade Commission, and of course the EU, the European Commission, the Commission nationale de l'informatique et des libertés, excuse me, my French is, I'm sorry, and Information Commissioner's Office, which is in the UK. Have an understanding of what they are. And again, you don't want to be thrown by these acronyms or abbreviations while you're taking your exam. Information flow and life cycle. All of these organizations into which that regulate and function with regard to healthcare technology, electronic health records, health information exchanges, regional health information organizations, the RHIOs, and of course be familiar with ARA, the American Recovery and Reinvestment Act, and of course HITECH. Health data characterization. This just has to do with our responsibility to classify data with regard to risk management, the legal discovery, in other words, can it be subpoenaed to be evidence in court, as well as compliant issues. Be familiar with what the National Provider Identifier is, and also the 3 levels of healthcare provider taxonomy. Data interoperability and exchange. This is what we're talking about. HL7, be familiar with what it is. DICOM, which is digital imaging and communications. This is part of the responsibility to have imaging, x-rays, MRIs, and CT scans that will flow directly into EHRs and has other responsibilities. And the IHE, integrating the healthcare enterprise. And lastly, in this domain, we have the designated record set, which is the definition for legal medical records. So you want to remember that this is important because healthcare records can be subpoenaed and used as evidence in court, which means every I dotted, every T crossed, because they are legal documents. There are very special rules that regulate anything having to do with the care and maintenance of this documentation. Okay, that is Domain 1. If you have any questions, please post to the Domain 1 discussion and we can talk about it. We want to make sure you're ready for your exam.